I recently discovered a company that highlighted how text messaging has the potential to save millions of lives and billions in healthcare costs, all by ensuring patients adhere to their prescriptions. But that's just the tip of the iceberg, and also what they do. For example, did you know that non-adherence accounts for upwards of 50% of doctors' visits, 40% of long-term care admissions, and more than 50% of hospital readmissions? And technology offers so many simple solutions to a devastating problem, especially for managing chronic conditions like diabetes, hypertension, and mental health disorders. So I wanted to find out more about how technology can change things for the better. So I invited Curizon's CEO, Nicholas Rumble, onto today's show to talk about how Curizon's approach to tackling this critical challenge could help transform healthcare. So buckle up and hold on tight as I beam your ears all the way to Copenhagen in Denmark so we can speak with Nicholas James Rumble from Curizon. So a massive warm welcome to the show. Can you tell the listeners a little about who you are and what you do?
Well, thank you for having me. My name is Nicholas. I am the founder and CEO of Curizon. We are a healthcare technology company, and we provide drug adherence technologies and big data solutions to the world. We're working primarily in the area of drug adherence and also in working with pharmaceutical industry and other researchers, academia and so on, in trying to improve patient outcomes, treatment and therapy guidelines. As I guess our maxim really is that improving healthcare, reducing costs and saving lives is what we're all about.
So when I was reading about you guys, I quickly came across CuraServe technology in Curizon, and it helps to ensure that patients are taking their medicines as prescribed by their doctor. But can you just tell everyone listening about how you're leveraging technology to help patients live longer and having healthier lives as a result of that?
Sure. Well, the headline statistics are fairly clear and make for some alarming reading, actually. Chronic disease and long-term illnesses such as diabetes, asthma, heart disease, hypertension, cancer, etc. These now affect half of all adults in the West. And the problem is further exacerbated by non-adherence. So it's estimated that between 50 and 75% of people suffering from long-term or chronic illness fail to take their medication as prescribed, which makes drug non-adherence the fourth biggest killer globally, and it leads to more than $700 billion in avoidable healthcare costs annually. And that's not to mention the $630 billion each year that the pharmaceutical industry loses in lost revenue. So we utilize the best distribution channel to notify patients to take their medication on time every time, and then we escalate non-adherence when it occurs to their emergency contact. So we're thereby engaging family members and as a stakeholder in the chain of care. So one of the things we know is that while we can be positively negligent of our own care, we're very much better at taking care of those we love. So by doing this, we see huge increases in adherence levels, and therefore we can reduce the burden upon healthcare providers. Engaging with technology is really the most effective way for a patient to improve disease management, and here at Curizon, we're really on the cutting edge of this smart health revolution.
I read a great quote on your Twitter feed recently, which was, if adherence therapy was a new drug, it would be hailed as a potentially major advancement in medical treatment. And just reading that, it was something that really resonated with me, and I think it's an incredibly refreshing way to look at how to improve healthcare whilst also reducing costs and saving lives at the same time. But how accepting have the healthcare industry been to this approach, and what kind of feedback have you been getting?
Yeah, it's a great question. So, I mean, first of all, the quote that you mentioned, that was from Professor Richard Gray, actually. He works for the Nuffield Department of Population Health in their Clinical Trial Service and Epidemiological Studies Unit. So he's right at the forefront of this, and he's absolutely right, of course. So, for example, in very simplistic terms, if we were to increase the adherence of type 2 diabetics in the UK by, say, 10%, the National Health Service would reduce their costs by more than £2 billion per year and save numerous lives. So our expectation is we can increase this by as much as 37%. So you can see very quickly how a small input from our side in improving adherence can have a very significant impact in both the costs for the providers of the health services and also the patients themselves.